I had a tremendous week, very challenging. And yes, you could almost feel a little bit like burnout. And we've got Dr. Seshni. You get that feeling where your body is saying to you, you just need to relax, you need to take time out. And so we're going to be discussing those things that impact on our health, and that is burnout. And so welcome to Dr. Seshni. Hi.
Hello, Valma. Thank you for the wonderful introduction, and thank you for having me on your show. My body is my temple, so I'm so grateful to be on your show and to be talking about something that's really important. It's often gets neglected because we're dealing with the patient.
Yeah, that's quite true, because I've got an article here about mental health. The World Health Organization, 264 million people worldwide live with depression each year in England alone. 1 in 4 people experience a mental health problem on a weekly basis, says 1 in 6 will suffer from ongoing anxiety or depression, and 8 in 100 people are newly diagnosed with such conditions relating to mental health. And it even goes on to say that 1 in 5 of us will have a suicidal thought, 1 in 14 of us will self-harm, and 1 in 15 of us will actually attempt suicide. And women are more likely to do so more than men. I mean, the statistical data is quite concerning in terms of mental health. And for carers, as you know, I was involved in supporting family carers who look after adults with learning disability and autism and mental health. And truly, I can truly say that I have come across many of them who have had some form of mental health, anxiety, and burnout.
Yes, that's not, the statistics that you've just shared is shocking. Mental health is becoming more and more a problem globally, not just because of COVID, but because of obviously other underlying issues as well. And especially for carers, as you've stated, it's really challenging. I remember joining you on your talks for carers today and the amazing work that you were doing to help carers. But we need more of that, Valma. It is a part of care that is being neglected. I feel we're not doing enough, and we should be getting more people involved. But hopefully things are moving in the right direction in 2022. In terms of carer distress or carer stress and carers burnout, we know at least 85% of carers do suffer from this. So it is very, very common. It's something that most carers will experience at some time during the time that they are caring for someone. I mean, what is a carer, Valma? So anyone that is caring for someone.
Well, we know that anyone who is looking after someone, whether it's the person they're looking after has physical or sensory disability, somebody with a stroke, somebody with mental health, somebody who has learning disabilities. I mean, the individuals we're specifically talking about is carers who care for somebody with dementia or any form of mental health. And I know that I had actually cared for my mother, and I found it quite stressful. I mean, I felt on one occasion I was so much under stress that I actually, I was going to work and care for my mom, and I actually fell down the steps and broke my wrist because I was so stressed. and at that time I was also looking after children. And so carers out there, not only sometimes looking after one person, they could be looking after two person, and also looking after their family. I also am aware and have experienced where a carer has been looking after her husband, her father and her parent, both suffering from mental health and have to be driving distances to see one or the other if they are in separate homes. It's extremely challenging for them.
I totally understand that. And that's what we see, Valma. And thank you for sharing your story. I know we've spoken a lot about how you cared for your mom. And in those situations, we need to acknowledge, we need to understand, we need to show compassion and kindness to these carers because, as you said, it is challenging. It is not easy. We need to recognize that it's not easy. And we do need to provide services and help for people that we term or label as carers. So as you were saying, carer is anyone. We were talking specifically about carers, caring for someone with mental health and with other illnesses and other mental health conditions like dementia. And also, I mean, in terms of carers, they do say that the definition is anyone that's supporting someone else or caring for someone else, providing unpaid support. So it could be someone with an illness, with mental health, with a disability, or with addiction problems. So to be honest, a lot of people will fit into this category. And I think the key word is unpaid and supporting and caring for someone else. So even though it's not your responsibility, people are caring as carers.
But one of the other things is some individuals don't recognise themselves as carers. For example, when I've had to visit a family and I say to the wife or husband, you are a carer. They said, no, I'm not a carer. But they don't realise that they are a carer. But they also don't realise that they don't have to be a carer. I mean, a carer is a relative friend or a partner, or it could be a child, We know that there are children who are providing care, like giving their the person, the parent, medication, which they shouldn't be.
Yeah.
But we know that they are 12-year-olds, children going to school and caring for their parents. Before they go to school, then when they come home, and we've got to recognise what's happening to those children who can lose out on education. I mean, it's a whole big phenomenon around carers. We don't seem to. We need to raise the profile and for those individuals who choose to be a carer, people are giving up their jobs to care. I mean, the government is quite lucky that we have individuals, relatives, neighbours who are kind enough to want to care for their relative or a friend. And we don't recognise the impact it has on them financially because, if they have given up their jobs, they are losing out economically, they're losing out on their professional career. And the carer's allowance, surely 60-something pounds a week, which is less than 50 pence an hour. We need to look after these carers because, they are contributing enormously to the state, but it's their health that's impacted on.
Definitely for me as a psychiatrist, working with the team, we often see carers coming to our clinics or in hospital settings, talking about how it is to care for someone. And it's not easy, it's challenging. As you said, we need to raise the profile. We need to acknowledge, recognize, and support these carers. Because as we said, the psychological impact is huge, Valma. And I want to go through a few points, if you'll allow me. So we spoke about burnout, we spoke about stress, carers distress, and this is very common. We commonly see it with all carers caring for someone with a mental health condition, specifically with people with learning disabilities. I know I've often seen this in my clinics, and from carers, from families, from relatives, and also for people with dementia. It's very, very difficult, very stressful, and we acknowledge it. And there's definitely, it's definitely something which people experience. So I think what we're talking about today is something that is experienced. So it's not something we are saying that, if you're caring for someone, this is what's going to happen. What we are talking about, Valma, is a reality. So the other things that can happen when you are caring for someone, whether it's a relative, a loved one, or a family friend, neighbor, or your spouse even, or a child. So it can cause you stress, it can cause you worry, anxiety. Some people do end up feeling quite lonely and isolated, and it affects their sleep as well, Valma, where they don't have enough time to sleep because they're having to care for someone else. Also, some of them might have some guilt, anger feelings, and also some frustration. We also know that it can end up in them feeling having a low self-esteem, and eventually some of them themselves, you said it very early on, that they end up having mental health problems. So they end up being diagnosed with depression, anxiety, and other mental health conditions. So and I think another thing I want to say is that the psychological impact is there. So what we do usually advise is anyone that's caring for someone needs to go through a carer's assessment. So when we train as doctors and psychiatrists and working within a team, this is usually offered to our carers. So we usually, when we first see our carers, Valma, when we talk to them about the conditions and educate them more about their loved one or their family member, we will offer them a carers assessment, and it's really useful.
Yeah. But a lot of individuals don't realise that they can have a carers assessment. In fact, under the Care Act, Carers Act, the Care Act 2014, within it says that a carer's assessment should be offered. It's not that a carer should be waiting for it. It's automatically offered, and I think carers really need to ask and make sure that they get it, and they don't realise that within that carer's assessment is assessing their psychological needs, their needs to be able to access education, employment, but also to access respite. And a lot of them don't realise that they can ask for respite support.
You took the words out of my mouth, because respite, and carers assessment. I cannot stress those two important factors. So coming to respite, definitely, Velma, when I worked a lot with dementia, and I still work with people with dementia, we do see it very commonly. The carer stress, carer distress, and burnout is evident. Our carers come to us telling us how they're feeling. They're feeling overwhelmed, they're feeling stressed, they're tired, they're not able to balance caring for their loved one, as well as, their own life in terms of taking care of their own family. And sometimes some of them are working. So it can affect them, and we do advise respite. Respite is so important because it gives the carer a chance to recover, rejuvenate, and, gain their strength and the ability to then care for their loved one again. And it's actually a very positive thing, and I would highly recommend it. I know you're very, very much involved with, in the past, with helping people with respite, and I'm so grateful to the social workers for all they've done to help and our carers to get the respite, because it does help. So it gives them that chance to recover, but it also helps our patient as well. So if our patient gets respite, they get to go into another environment where obviously they are well cared for. So it's a win-win situation, which I will highly recommend. Respite, I cannot stress the importance of it, Velma. We need more sort of provisions for respite. I know you've worked with it, so you'll have a view about how available respite is. I know when I worked in learning disabilities, we offered it very, very very frequently respite to families that were caring for people with Down syndrome, with dementia, with other mental health conditions, because it can become quite stressful and tiring. And also sometimes the behavior can be quite challenging, where the carer becomes on the receiving end, not intentionally, but they can be, the person with a mental health issue can become quite aggressive and violent and challenging, to the extent that no matter what you usually would be able to calm them and care for them with, might not help. So sometimes in those conditions, you do need to have urgent respite or urgent input from mental health services or community mental health teams.
Yeah, and unfortunately, some carers, because they don't know what support's available, it becomes a crisis management, where there's such a breakdown in the relationship, and it also impacts on the wider family. If you're responsible for looking after your children or your husband or whatever, caring becomes like the first thing you do, but you don't realize that it can actually impact on your other relationships. I've come across so many carers who, because of the enormity of caring, particularly for somebody with mental health, it's actually impacted on their own personal relationship, and there's a lot of breakdown between the husband and wife or the other siblings.
Yes, I mean, I'm really grateful to all the carers, because, to be honest, to be in that role, it's really difficult and challenging. And at the same time, they do it sacrificing their own needs, which they don't have to do. And as you said, some of it, we know that some carers, their own relationships have broken down, their relationships, their family lives, their social lives, their financial situation gets affected. So it does impact psychologically and in terms of the social aspects of a carer's life. So we do have to recognize that, it's so important, the role that they play. But at the same time, they do need to get help. They need to get a carer's assessment. They need to consider getting respite, and also consider their own well-being. So I think they need to understand, any carer that's caring for someone, they do it without expecting anything in return, but they do it because they love the other person and they care for that person, which is amazing. But they do need to consider their own well-being, because for any of us, even for myself, Valma, I will not be able to do what I do if I'm not mentally well, and I ensure that my well-being is 100%. So I think carers need to consider their own well-being before they obviously take on the duty of caring for others. It's great to care for your loved one, but if there is help and if there's other resources available, which there is, you do need to find out more from your community mental health team. You need to find out more from charity organizations like Carers Today. Valma, you were part of Carers Today. Your organization was able to help a lot of carers successfully, and I'm sure you saw the benefits of that help, Valma.
Yes. In terms of burnout, a lot of carers probably wouldn't recognise when they're going through burnout. Could you be able to go through some of the signs and symptoms of burnout?
Yes. So symptoms and signs of burnout. So as we said earlier on, Valma, so initially when people end up caring for loved ones, they do experience burnout, and it's because they are overstretching. So burnout so I'm going to give you the definition. So caregiver stress and burnout refers to when you overstretch your physical and emotional limits when delivering care to someone, whether it's a family or a friend, to the point in which a person stretches themselves before reaching a level of fatigue. So it is obviously something where the person who cares for someone overstretches themselves to the extent that they experience extreme exhaustion, fatigue, mental stress, physical stress, and a sense of feeling overwhelmed. So, I mean, you were describing earlier, Valma, how your week has been. So, yes, so I'm going to go through the symptoms and signs. So the common symptoms and signs, I have mentioned some of them already, is depression, anxiety, irritability, feeling extremely tired and run down, having difficulty in sleeping, becoming more vulnerable and overreacting to situations. So feeling very overwhelmed, Valma. Sometimes our carers can experience some physical health problems, so they can have new or worsening of the underlying health problems. They might have difficulty concentrating, feeling quite resentful, guilty, as I said earlier, and angry and frustrated. It might impact on them that they might start coping in other ways, which is unhelpful, like drinking, smoking, taking drugs, illicit substances, or eating more than usual. And they might end up neglecting their own responsibilities and cutting out on their well-being and leisure activities. So common signs and symptoms of caregiver burnout is, as I said, it's just you have so much less energy. You feel extremely tired and exhausted, and everything revolves around giving that care to the loved one. That you will not have any trouble. That you will have trouble even with your own day to day. So I think, and the final point is you can end up feeling extremely hopeless and helpless. So these are the main symptoms and signs, Valma, of carer burnout, carer distress, and yeah, and carer
I think
stress.
there's another area that I mean, I did some research when I was doing my master's, and in terms of carers being subjected to violence.
Yes.
Particularly in the home. And when I did ask the question about whether they were subjected to violence from the person they were caring for, many carers were very reluctant to talk about it or mention it because of fear of safeguarding issues. And so carer could be suffering, maybe looking after somebody with dementia who can be be aggressive, or even somebody with autism who can't express themselves and turn to aggressive behaviour. And carers need to know that they can talk about that with the social worker if they are subjected to that, because there's no need. The concern is if they're caring and they're subjected to violence at the same time, that's even more going to impact on their mental health.
Yes. So I think it's sort of like a catch-22 situation, Valma, where the carer obviously, there's this dissonance of them caring for their loved one, but at the same time, they're on the receiving end of maybe some challenging behavior, which obviously we know safeguarding is huge. We report anything when there's any signs of anyone being that's vulnerable, obviously like our patients that have mental health problems or disabilities or dementia, then we do take it seriously. We work in teams where safeguarding is huge. So obviously carers then are in a position where they feel that they can't say anything, they can't speak up. But actually the advice that we have is that carers do need to speak up. They need to get respite care. They need to get help. They need to delegate the responsibilities. And they need to give themselves a break as well. Because I think if they follow these steps, and it's not that easy, I know, but if they do try to follow these steps, it will definitely make it easier for them to provide care in that role, and also to maintain a healthy relationship with their loved one or friend or whoever that they are caring for. Because if they are not going to be able to speak up, then obviously it's going to impact on their own mental health and well-being. And the last thing you want is a carer doing something which obviously puts them in a position that isn't good. So, the carer's role is so important. We are grateful to all carers, and I'm sure anyone that's caring for someone, it's not easy, but they do really to recognize that they need to get help, respite, care, and speak up, and share the responsibility with other people.
Yeah, and the other area I came across when I was running the carer support group, because when I was in Barnet, I set up a male carer support group, and and also did some research in the 3 hospitals in Finchley, and recognised that men who are carers also are affected, because in terms of their own self-esteem, being able to go out to work and feel that they're the breadwinner, and all of a sudden have to give up their job or caring. And I came across men who didn't talk about having that responsibility for caring, and that they have to be recognised. More importantly, I mean, not more important than female carers, but I know that male carers, when they went to the job centre to look for work, and they've been caring, they felt that they were treated a little bit unfairly, because their skills in if they've been caring for the last 5 years, and they put that down, they complained that they weren't taken seriously. So there's a whole area of identifying how we can support these enormous amount of carers. But also we've got to recognise that the individual doesn't have to take on the role of caring. They do have a choice as well.
Yes. So that's important, Valma. You spoke about men that are not able to actually speak out and speak up about their roles that they're playing. And it's important that they do have that self-esteem, which enables them to be able to do that. And I think obviously men compared to women, men find it more difficult to express how they feel and to say anything. So it is important that men as carers do speak up and do share that responsibility with others. And also, as you said, Valma, you don't have to be the carer for that person. There can be other provisions made for that person. So I think it's important to recognize that. And I think we've seen that a lot when I worked in inpatient settings and in community settings, where we've had families come with their loved ones, patients with dementia or autism, and they wanted to care for them up until the end. But then sometimes we've had to explain as a team that, we acknowledge that you've done so much, you've cared for your loved one for so many years, but we do need to consider other provisions, because the carer is not going to get any younger. They're going to get older. They're going to have their own needs, and sometimes they do need to consider whether putting them in a place with more care, with more provisions of 24-hour care and support, and trained professionals might be an option. So it's a very difficult, challenging conversation to have with carers. It's been very difficult to have those, I can tell you. But in the end, at the end of the day, we will do what's in the best interest for the patient and for the person that's being cared for. So I think we always need to recognize, and we need to demonstrate that to the families as well, that at the end of the day, part of the NHS ethos is having person-centered care, patient-centered care. So keeping our patients at the heart of everything we do. So whether it's a carer that's going to provide that care, or whether it's going to be another service. And then, so that's the main things, Valma. And I wanted to say, in addition to all the other advice I said about carers, the carer support group you said is really important. And I think that's one of the other advices, is for anyone who's caring for someone is to join a support group, because sharing that within a group, Valma, I'm sure in Barnet, when you had that group, it gave people an opportunity to share in something which they all had an experience with. And it's cathartic when you're going through something with other people that are going through similar things. It feels easier. It feels easier to get through. And there's other like-minded people that have gone through the same thing, and that can also help and support you. So it's like a problem shared is a problem halved. It's like you share that problem, and it makes it a lot easier. So I must say, that it's great that there's a lot of support groups for different conditions. So for carers, they can have a look. There's support groups for anything, for dementia, for autism, for depression, for bipolar, for addictions, OCD, panic, any type of mental health issue or problem, eating disorders, addictions. There is Alcoholics Anonymous. There's so many different support groups for all these conditions. So we are so fortunate. And a lot of these groups are online as well. So even if you're finding it difficult to get, time out of the day of caring for someone, you can still attend these groups. Do look at charity organizations like Mind, Carers Today, Carers UK, and other carers organizations. Organizations like Beat for eating disorders.
Yeah, the other thing is, I mean, in the UK, GPs also are playing important for us. So a carer can actually speak to the GP, because GPs now are responsible for ensuring that they do have carers registered with them. So a carer can go to their GP and say that I'm a carer, and the GP should be able to refer them onto the appropriate carer centre, but also to make sure that the carer's physical health is assessed. So carers shouldn't feel too embarrassed to go along to the GP and say, look, I'm a carer and I feel overwhelmed, or I'd like some respite, or I'd like to have my assessment. But if the carer has underlying health conditions that can impact on their caring, such as diabetes, or they even have a mental health problem, they can speak to their GP, because their GP also is responsible to make sure that their health is is taken care of.
I think that's so important, Valma. Thank you for recognizing that, and definitely taking the responsibility as well. So the responsibility of care is not just with mental health, but also at primary care level with GPs and healthcare practitioners, providing that support, identifying and recognizing if a carer needs support, if they have any underlying conditions, health conditions, which can deteriorate if you're not, if you're caring for someone because you don't have the time to take care of yourself, if you've got diabetes or high blood pressure or high cholesterol, or if you're stressed and if you've got other mental health conditions. So carers going to GPs and healthcare professionals is so important. It is important that they take care of their own health. So yes, so advice would be for any carer to keep on top of your doctor's visit and make sure you are taking care of your own health, as well as your other, keeping up with your appointments, because you need to be healthy to take care of your loved one. Exercise is really important. Valma, I do the Happy Doctor's Kitchen. So boosting the serotonin by exercise and the things you eat. You are what you eat. So make sure that you are having enough exercise, at least 3 times a week, 30 minutes of exercise, and that you are eating healthy, at least 5 servings of vegetables if you can. Practice relaxation techniques. Meditation is something I definitely recommend, or breathing techniques is really important. Practicing mindfulness, and getting enough sleep. I think sleep and water and sunshine if you can.
Yeah. And also there's the social prescription, where the GP can, instead of give medication, could refer them for a social prescription, which can include relaxation therapy, even getting access to books and all sorts of things. So carers can I speak to their GP to see whether they can refer them for a social prescription.
I was going to say exactly the same thing earlier on, but then I started talking about other things. Yes, social prescription is so important. So that's exactly what I was trying to get at as well, when Valma's pointed that out. So social prescription is really important. So, I think because there's obviously the financial difficulty when you're caring for someone, if you've had to leave your job, leave the country, or, travel somewhere else to take care of your loved one. So obviously social prescription is there, and it's been recognized that GPs then can provide that to people that are carers. It is really important. I think for any carer, Valma, you've done it, and it's not easy, but I'm sure definitely with the help, any help that you can get, it does make it easy. So I think for me, it's just about, recognizing the importance of carers, the role that they play, even though it's not their responsibility, recognizing that they can get help, they can have a carer's assessment, and they can seek help from GPs and healthcare professionals. There's more information on the Royal College website of psychiatrists, Valma, so www.rcpsych.ac.uk. And I'm sure on your website, the Carers Today, you probably will have some more information as well. So carers do need to get help. Look at Mind as well in other organizations. It's important. And respite is key. So make sure that you do get some respite. And I think it should be something that throughout the year, if you look at 12 months, if you're caring for someone with a mental health problem like dementia, or someone with learning disability, with autism, or with anyone with addiction problem, eating disorder, bipolar affective disorder, depression, anxiety, OCD, anyone with any sort of mental health conditions, if you are caring for someone, if you are having to give them their medication, help them with their finances, with their chores, help them to get dressed, help them to have a wash, if you, and anything that you need to be doing, help them with their meals, just, spending time with them, taking them out, getting their groceries. There's so many people day to day, Valma, that are in this role.
Also, it might be the simple thing, like just collecting their newspaper.
Yeah.
We live in a world where, having these support is needed, and it can reduce the anxiety and the feeling of isolation, or that you're coping alone.
Yeah.
So it's so important for carers, and also to recognize that if you've got brothers and sisters, and you could share the caring, that's even better, because some carers feel that as one sibling that they are totally responsible, and that the rest of the family are not supporting them. And that's one of the things that carers actually say, that, it's sometimes not a shared responsibility. They feel as a part of a family that they are the ones who are doing all of it. And it causes so much conflict. So it's about talking, isn't it? It's about them talking together and saying, well, how best can we all share in this responsibility?
Exactly. I think sharing the responsibility, and even if you are not nearby that person, you can still provide some sort of support. So for example, if you're a family and there's few siblings, and you're having to take care of someone with dementia, you can have like a rota of in the 7 days, delegate different duties to each of the family members. And even if the person is not close by, the other relative can still help. They can maybe make a phone call, or they can help to organize certain drop off, like maybe some groceries delivered. There's so many different things that we can do to help. But we in a technologically advanced age where there's so much of support online, there's so much of services that can be provided by just clicking online and getting that service for someone. So whether you want to deliver some flowers to cheer someone else up, or deliver some, some groceries, or get them, a haircut or something, there's things that can be organized. So I think it's about being creative, being innovative, and using the services that's available. And I think carers need to think about doing that as well, so that they don't feel like they've got the whole world on their shoulders. Because when you have that feeling, Valma, that's when burnout is going to be.
I do agree.
Exactly. Burnout, stress, tiredness, fatigue, exhaustion. And then when you come to that point, Valma, it's a point where you are of no use to anyone else. So to all the carers, take care of yourself, ensure your health and well-being, and continue doing an amazing job helping others and being of service to others, because that's what we all are here for. We're all in some way a carer, but do get the help. And thank you so much, Valma, for this opportunity to be able to talk today.
Well, thank you so much. And we'll be back again, because next week, although Dame Philip Russell wasn't able to attend to participate in this interview. She is going to be available next week, and I've also got Richard Courtney, who's going to be talking about insomnia.
Oh, so fantastic! That sounds amazing.
Working towards promoting the well-being of population of carers as well as individuals. So thank you so much for stepping in today and just starting the conversation around how we can promote and support our 7 million carers in the UK.
So wow, 7 million. Thank you, Valma, for having me. I definitely look forward to hearing your show with Dame Phillips. She has a lot of experience. We met her together, and and to hear about insomnia. So stay safe, everyone, and have a fantastic Saturday.
Okay. So thank you so much, and take care and have a great day.
Namaste. Bye, Valma. Thank you so much.
Bye-bye.
Thank you, everyone, for listening, and have a fantastic Saturday. Namaste, and stay safe.